Hi, this is Glenn Macno. I'm here again today with Dr. Alan Seftel, who is the head of urology at Cooper University Healthcare. Doc, we've gotten a lot of questions that people have about men's prostate health. Let's dive right in, and you're here to answer them today.
Happy to be here.
So here you go. Question number one, why is it, somebody asks, when I urinate, does it feel as though I don't fully empty my bladder?
Oh, great question. Very common in men once they start hitting a certain age, and I won't tell you what that age is because it varies.
Okay.
Some people it might happen a little bit earlier in life, some men a little bit later, but the majority of men start noticing some slowdown in their urinary stream probably about early 50s, mid-50s. And usually the inability to empty is due to an enlarged prostate. It could be due to a bladder problem as well, but in the majority of men that we see, it's usually an enlarging prostate, restricts the flow and doesn't let the urine come out fully.
Okay. I'll throw in my question here. This one isn't me. This is me. I usually wake up once a night to pee, usually at 4 to 5 a.m. Is that normal? And as men get older, is that going to change?
So it's normal for a man of your age. I'm assuming you're about 50 or so.
Oh, you're the best.
Thank you. But yeah, pretty much normal for most men in their 50s and 60s. As you get older and as the prostate continues to enlarge, that'll probably worsen a bit. So you may notice that you get up twice at night, even 3 times a night. And also will depend on what you drink before you go to bed. So if you drink a couple of bottles of water, or a beer or a glass of wine, you may notice you may get up a little bit more frequently. So most men have learned actually to cut back on their liquid intake probably about 7 or 8 o'clock at night to decrease their getting up at night.
All right. Dr. Seftel, just a very general question. What is BPH or enlarged prostate? What does that mean?
Well, it's a prostate gland is when you're a young man, it's really there to help you reproduce. It helps give the sperm the nutrients. It gives a lot of enzymes to the sperm and allows the sperm to make their way through the vaginal tract and impregnate the egg. As men get older, the prostate no longer functions that way. It becomes more of a nuisance than anything else. It enlarges. So basically the prostate just enlarges, and that's what BPH is. It's an enlargement of the prostate. Sort of akin to when women get an enlarged uterus or a fibroid. Sort of the same analogy.
All right, so then the question is, what can I do to avoid an enlarged prostate?
Very little. Unfortunately, it's just a natural part of aging. The prostate grows due to a man having testosterone and a variety of other factors in the blood that cause it to enlarge. So unfortunately, there's very little that can be done other than taking some pills. But the pills have many side effects. So I usually tell people about the side effects and they sort of will not get involved with the pills.
Okay. Very serious question here, Dr. Seftel. Somebody says, I'd like to know the symptoms of prostate cancer.
Well, sometimes prostate cancer in its early stages has no symptoms. That's why we historically had always relied on the blood test, the PSA, along with the prostate exam. Over the last few years, there's been a lot of discussion in the literature and in the lay press about the need for prostate blood tests because people felt we were overdoing it and bringing people to surgery and treatments that may not have been necessary. So that's created a lot of confusion, I think, amongst many of the individuals out there. Nonetheless, unfortunately, early stage prostate cancer is no different than just an enlarged prostate. You may have voiding symptoms, you may get up at night, slowing of the stream, things like that. Late stage prostate cancer, however, is different. You may have metastatic disease or a disease that moves to the bones and have bone pain, things of that nature. So that's where we get a little more concerned.
All right, at what age should men start screening?
So the standard guidelines right now are that most men should have a PSA test and a prostate exam, probably about 50 or so. If you've had a first-degree relative with prostate cancer, or if you're African-American.
First-degree relative meaning father, brother, something like that.
Right, father, brother, something along those lines, and I would say move it down to 45. Or if you're African-American, then I would say about 45 or so as well.
Okay.
Or if you have a man who comes in and he's 40 or 35 and he's got some very unusual symptoms and they don't clear up with standard therapy, then that person would be benefited by having a blood test as well.
And Dr. Seftel, presuming you screen well, how often should you do it after that?
Well, again, the guidelines have come out saying about every 2 to 3 years now in the standard fare. We may be more aggressive depending on the clinical situation, but 2 to 3 years I think is a reasonable number for most individuals who don't have a family history and really don't have much symptoms and do not have that much of an enlarged prostate on exam.
All right. Dr. Septel, somebody asks, how important is it to take vitamins every day? And this is a 28-year-old man asking the questions. He says, my main exercise is long distance running a few times a week.
Again, the data on vitamins and longevity and running are not great. I think if you have a vitamin regimen that you think helps you, then certainly go with it. You have to be careful about what you buy over the counter because unfortunately most of the things that you buy are not regulated by the Food and Drug Administration. So you don't know what you're getting.
Are you a fan of the once-a-day multivitamin?
I think that, again, if you are comfortable with it, if you think it helps, then that's fine. I don't endorse vitamins, again, because we don't have a lot of great data on most of these things. So I try to avoid giving people blanket endorsements for things where we don't have a lot of quality studies.
All right. Dr. Septel, what is the best way to naturally boost testosterone levels without taking medicine?
Well, again, I think if you can lose some weight, exercise, and have a little more of a heart-healthy lifestyle, that will naturally increase your testosterone levels. If you're diabetic, getting your diabetes under control will be a great way to boost your testosterone. So those are the things that unfortunately people are not willing to undertake because they're very hard.
It's not the easy magic.
It's not easy, and so there's very little that can be done as far as natural remedies. At least, again, that's approved by the FDA. There's many things out there that people will try that are over the counter. They'll hear about. We, again, don't endorse those because the data are just not there to support their use.
All right, one more question. What is your take on these joint lubrication / supplements that contain glucosamine? I'm 47. I'm in good shape. I'm pretty active. I've taken them recently. Do you think they work?
Well, I have no reason to believe they don't work. Again, the people that have come in and have used them seem to have benefit. They won't help sexual function. They won't help other areas, but certainly with the joints, I've seen, at least in my brief experience, limited experience, that they do seem to help.
All right, Dr. Alan Septel, Chief of Urology at Cooper Healthcare Systems. Thank you so much for your time, for your wisdom. I'm Glenn Macnow. We'll be back. You'll hear us do this again.